I welcome this opportunity to address you. Your discussion on global health in the context of the Millennium Development Goals is very timely in light of the September 20th, 22nd summit on the implementation of the MDGs. This conference has been convened to articulate a vision in which human rights and development are seen as consonant and mutually reinforcing objectives. As the Secretary General underscored, economic growth is a necessary but insufficient condition for progress on the MDGs. Indeed, where economic expansion in some countries has alleviated poverty, this positive result has been uneven and has often left unaddressed structural conditions of discrimination and inequality that condemn far too many people to a life of hunger, illness, and vulnerability. A human rights approach to eradicating conditions of underdevelopment helps identify and tackle inequality and social exclusion at their very roots. It creates a framework that promotes a level playing field for all to enjoy a life of dignity and rights. This approach bolsters accountability by clarifying the duties and responsibilities of governments, donor countries, and non-governmental organizations regarding action taken or omitted. From a human rights perspective, participation of rights holders is a key component of effective policies. In designing solutions, the most vulnerable must be engaged as proponents and engineers of change. This not only makes policies and programs truly representative of those they seek to assist, but it also empowers individuals and communities to claim their entitlements and rights. Available information indicates that governments which have explicitly linked their human rights obligations to the development of MDGs policies have made the greatest advances. Health policies which purposefully reached out to the poor and the most marginalized and gave them access to care exemplify such progress. Let me emphasize that several international human rights instruments define health as a right. Article 12 of the International Covenant on Economic, Social, and Cultural Rights describes it as the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. It must be pursued in consonance and in synchrony with all other human rights. These rights are an indivisible and organic whole, inseparable and interdependent and of equal importance. To be sure, many other rights depend on the enjoyment of health and access to health care. The issue of health is also situated at the very core of the MDGs, that is, curbing extreme poverty, offering education opportunities to all, removing gender inequality, reducing child mortality, improving maternal health, combating HIV, malaria, and other diseases, ensuring environmental sustainability, and developing global partnerships. None of these goals can be achieved without consideration of the full range of human rights, including the right to health. Consider Goal 5, namely, improving maternal health. The World Health Organization estimates that up to 98% of the annual 500,000 deaths related to pregnancy and childbirth complications could be prevented with low-cost, targeted interventions, policies, and services, all of which have been known by the medical profession and health systems for decades. Despite this knowledge, maternal health remains the least successful of the 8 goals. Failure to achieve progress on this vital goal indicates a failure to implement key human rights principles such as equality and non-discrimination, meaningful participation, and accountability. We know that the 4 main drivers for preventing maternal deaths depend on the exercise of rights, including access to health care, equal access to education, and equal economic opportunities. States must help women attain these rights. They must recognize that violations of human rights are intrinsic triggers of maternal mortality. Such recognition will be an indispensable and long overdue step on the path to prevention. Finally, let me emphasize that civil society is an indispensable partner for the achievement of this and all other Millennium Development Goals. You insist that human rights be placed at the center of policies designed to fulfill the goals and to save lives. Your help, ideas, energy, and passion remain crucial to this endeavor. Thank you.